Okay, seriously, did you know that your puffy, bleeding, inflamed gums could actually be raising your risk for heart disease? Yeah, your mouth can affect your heart, and most people have no idea, which is unfortunate since cardiovascular disease is the leading cause of death in the world. Yes, el mundo. But here's the part that might surprise you even more. Your mouthwash may be contributing to the problem. It might be creating this whole different cardiovascular risk through a completely different pathway. Stick with me because by the end of this video, you're going to understand both of these things and walk away with some really simple practical swaps you can start today. We'll cover how oral health connects to your heart, what dental hygiene product you probably use daily that could increase your blood pressure, and I'll also share what I do and reveal this weird clean mouth hack that I really love. You seriously don't want to miss this one. Welcome, everyone. I'm Natural Dr. Amanda, a naturopathic physician with over 10 years of clinical experience. And I'm here to teach Christians about how to apply real, evidence informed preventative health strategies for everyday life so we can all live long, healthy lives collectively and teach more and more people about the love of Jesus. So if you want to be more intentional about your health, you're in the right place. Go ahead and subscribe because I talk about these topics often. It's my passion and purpose for everyone to have healthy cells. All right, let's get into it. So here's something that conventional medicine has been slow to fully embrace, but the research is now very clear on. Your mouth is not separate from the rest of your body. I know that sounds obvious when I say it out loud, but think about how we treat dental health versus general health. They're almost always siloed. We go to our dentist for our teeth, and then we go to our primary care doctor for our heart or other concerns. And perhaps if we have a serious heart problem, we see a cardiologist. But everything in our body is connected. This is how God designed us. Hence, the naturopathic principle, treat the whole person. So your mouth and heart are connected. Here's what the science actually shows. Periodontal disease, which is just a fancy term for chronic gum inflammation and infection, is independently associated with cardiovascular disease, including coronary artery disease, stroke, and even cardiovascular related death. And I want to be clear, these associations hold up even after researchers account for other risk factors like smoking and diabetes. Why? Because when your gums are inflamed and bleeding, bacteria from your mouth can slip into your bloodstream through that damaged tissue. Once in the bloodstream, those bacteria and the inflammatory compounds they trigger can cause systemic inflammation, damage blood vessel walls, and actually accelerate the buildup of arterial plaque around the heart and in other places. Here's the part that really gets me. Researchers have actually detected DNA from oral bacteria inside of arterial plaque. Yes, they found mouth bacteria in heart arteries. That's not a small thing. Your heart can be affected by bleeding gums. So, if your gums bleed regularly, you need to see a dentist ASAP to get the situation under control. Okay? Now that you know why we want to take gum health seriously, you may think grabbing a big bottle of that strong antiseptic mouthwash is going to help resolve the problem. But here's where it gets a little complicated. Many of the most popular conventional mouthwashes, particularly those alcohol-based rinses, are what we call broad spectrum antimicrobials. If your oral health is not ideal, your dentist may prescribe a short-term prescription called chlorhexidine, which is also a broad spectrum antimicrobial formula. Short-term use of chlorhexidine is technically not the problem. The main issue is when over-the-counter alcohol-based mouthwashes are used excessively. They don't just target harmful bacteria. They wipe out everything. including the beneficial bacteria that your mouth actually needs. And this is where I want to introduce something called the nitrate, nitrite, and nitric oxide pathway. And I promise it's simpler than it sounds. So basically, when you have beneficial bacteria living in your mouth, this bacteria helps convert nitrates in the foods that you eat, things like leafy greens and beets, into a compound called nitric oxide. Nitric oxide is critical for healthy blood vessels because it helps them to relax and dilate. It supports circulation and it plays a significant role in maintaining healthy blood pressure. When you consistently use strong antiseptic mouthwashes, you can disrupt these beneficial bacteria, and some research actually has shown it increases blood pressure. Now, I want to be clear. This does not mean that all mouthwashes cause this problem. It simply means super clean is not always better. So let's stop treating our mouths like the goal is to sterilize everything. Clean is good enough, and a healthy diet can support and promote growth of beneficial bacteria in your mouth and throughout the rest of your body. So, what's the bottom line? If you're reaching for a harsh mouthwash every day, thinking you're doing your mouth and heart a favor, it's probably more complicated than that. So with all of this in mind, I'm going to share what I do. First, I brush twice a day. That's a non-negotiable, morning and night, regardless of how tired I am. Second, I floss nightly, unless I'm water fasting and didn't eat anything that day. I actually want to take a moment to emphasize the importance of flossing because it's usually underestimated and probably only done regularly by the A-type folks. But everyone needs to floss. Brushing cleans the surfaces, but flossing gets between the teeth. That is, it can help clean the proximal surfaces where bacteria love to hide and where gum inflammation often starts. It matters more than people think. Also, using a water flosser, that should not be used as a substitute when using actual floss is possible based on the mechanical way floss removes plaque from the teeth. So here's a hint though. Make sure you use floss that's coated with beeswax or some other natural materials. If the manufacturer doesn't disclose on the packaging what's used to coat the floss to make it more slippery, don't use it. You can learn more about why in my book. The link is below. So back to my regimen. Third, I also use a non-alcohol based mouthwash. I usually look for versions of mouthwash with essential oils that can do a good job killing off the bad bacteria while preserving more of the good bacteria. Balance is the key. And now for my weird clean mouth hack. About once a week, I oil pull. Let me know in the comments if you've ever heard of oil pulling or if you've tried it. Did you like it? If you've not heard of it, that's okay, because I'm going to teach you. Oil pulling is an ancient practice where you swish oil in your mouth for an extended period of time, around 15 to 20 minutes. The most common oils used are sunflower, sesame, and coconut. Sometimes I supercharge mine with a few drops of essential oils like peppermint or fennel, maybe tea tree or clove, each of which has its own antimicrobial and anti-inflammatory properties. By swishing these oils around in your mouth for a long time, you essentially create something that's similar to a detergent, which effectively removes and pulls many of the harmful bacteria along with some plaque out of your mouth, especially from those places that are not so easy to reach. The research on oil pulling is interesting, so I'll address this in a moment. When you oil pull, you do need to actively move the oil around in your mouth for the full duration of the practice. Just multitask while you do it. You could shower, clean up your house a bit, or respond to emails. And if the 20 minutes is like way too long to start, you can work your way up to it in like 5-minute intervals. Also, very important, don't swallow the oil. It can cause disturbances in your gut. It won't feel good. So when you're done, the used oil mixture should be spit out in the garbage. Even better, use a container that's in your house that you're going to throw away anyway, and use this for collecting oil pulling waste. Just don't spit it out in your sink or flush it down the toilet. Otherwise, you might need a plumber because eventually that oil can solidify and clog your pipes. Rinse your mouth out with some water afterwards and then marvel at your refreshed, glistening mouth. Now, I always want to be honest and share the latest scientific evidence with you, so let's talk about what the research actually reveals about oil pulling. Oil pulling does appear to modestly reduce plaque and bacterial burden in the mouth. Perhaps the sensation of a much cleaner mouth is due to better moisture balance as well. Some studies show improvements in plaque scores and reductions in salivary bacteria. There are even some studies comparing coconut oil pulling to chlorhexidine that show somewhat similar plaque reduction with less tooth staining from oil pulling, which is a bonus. For the record, swishing water around in the mouth can also be beneficial, particularly after meals or after you eat something with sugar in it. So the mechanical swishing action actually matters a lot. Let me be really clear though, the evidence on oil pulling is still limited because most of the studies are small, short-term, and may skew the results in favor of this practice. So at this point, it seems oil pulling alone is not more effective than consistent brushing and flossing, and oil pulling should not be used as a replacement for foundational oral hygiene. This is why I personally use it as an adjunctive part of my weekly self-care regimen strategies. The essential oils I add bump up its antimicrobial potential in a way that plain oil just doesn't offer, and the research validates this. So check it out if you're interested. One more option worth mentioning for those of you who want a gentle rinse that doesn't disrupt your oral microbiome as aggressively is diluted hydrogen peroxide. At around a 1% concentration, which is much lower than what comes in the brown bottle from the drugstore, it can provide mild antimicrobial and anti-inflammatory support and appears to be less disruptive to beneficial bacteria than chlorhexidine or alcohol-based rinses. That said, it's not strong enough as conventional mouthwashes for plaque control. So again, it works best as a supportive tool alongside brushing and flossing, not as a standalone solution. If you want to make a diluted mixture, around 1%, that shouldn't irritate your mouth, simply mix 1 part hydrogen peroxide from the brown bottle from your drugstore with 2 parts water and swish. Here's a big takeaway. Your mouth is one of the gateways to your body. And oral health isn't just about fresh breath and a pretty smile. It's about inflammation. It's about your oral microbiome. It's about your heart health and your long-term wellness. The good news is the most important things you can do are very simple. Brush consistently, floss, especially at night before bed, and be more thoughtful about what you're using for mouthwash and how frequently or how long you use it. Maybe switch it up and rotate through a few good options shared in this video. Also consider incorporating more gentle oral microbiome friendly options like oil pulling. Implementing these strategies is stewardship, my dear brothers and sisters in Christ. So let's take care of the bodies we've been given with wisdom and intention, not fear. Just practical daily habits that add up over time. In John 14:27, Jesus said, I am leaving you with a gift, peace of mind and heart. And the peace I give is a gift the world cannot give. So don't be troubled or afraid. So we needn't fear cardiovascular disease, but we should take reasonable steps to decrease our risk. If this video helped you see oral health in a new way, please give it a thumbs up and share it with someone you love. All right, see you all in the next video. Yay! Healthy cells.